I'm starting a new day, a new place to come. My home, look out, I'm running.
Casey, why is it important for all women to check their pelvic floor health?
Look, I think it's a really important issue because it's a very taboo topic and lots of people don't want to talk about it. It's not normal to have bladder leakage when you're walking, running, sneezing, coughing. It's not normal to need to go to the toilet 20 times a day and 6 times of a night time. Those kind of things can be a sign that your pelvic floor is not as strong as it should be. I did a course a little while ago and I was shocked to realise that 50% of women who have incontinence issues are actually under the age of 50, so it's not an issue that just affects the older generation. And I think another reason that it's really important is there's a bit of a push at the moment with the bladder leakage pads and the ads that you see on TV, and I think it really sends the wrong message because there is things that you can do to improve your pelvic floor health, not just wear a pad to try and stop the leakage.
That probably leads to our next question, Casey. So why is it important for women who exercise to learn how to correctly use their pelvic floor muscles?
The reason it's so important is because actually this little point up here, 4 out of 10 women do not actually activate their pelvic floor correctly. They're actually bearing down on their pelvic floor when they're exercising, which makes it much harder for their pelvic floor to work, and over time that will lead to weakening of their pelvic floor and then potentially incontinence issues. The pelvic floor is really important because it's often the things that keep us nice and healthy that are the things that are going to stress out our pelvic floors. So it's things like running or jumping or even simple exercises like a wide leg squat can all affect our pelvic floor and make it much harder for our pelvic floor to work. So in terms of keeping ourselves healthy for the longer term, we really need to make sure that our pelvic floor is working.
You want to jump on the trampoline with your kids?
Correct.
Get those pelvic floor muscles working. Casey, who can women consult about their pelvic floor health at Willows?
Within the Willows Centre, people can consult myself about their pelvic floor concerns. What the gold standard for investigating the pelvic floor is actually to have an internal examination done with your GP or with a specialised women's health physiotherapist. For some people that's a bit too confronting and a bit too off-putting and they're not sort of ready for that. If that's the case, then certainly what we can do here at Peak Performance is we can use our real-time ultrasound machine and we can have a look at getting an image of your bladder and bringing that up on the screen so that you can see what's happening with your pelvic floor. So we're watching the neck of your bladder and that should be lifting as you're activating your pelvic floor. If you're activating it correctly or if you're bearing down, as we mentioned before, what we actually see is we see the whole bladder drop down. So, it's a nice little feedback for you to know if you're doing it correctly or not, because often when you think you're doing it correctly, you're actually not. So that's a good little tool. Also the other thing is Carol Archer here at Willows and myself also work together to try and help people understand what pelvic floor safe exercises are, and Carol also has a lot of support services and resources that can help people out if they need it.
Well, Casey, that's been really helpful information. If ladies would like further information, what else can they do?
Look, a consultation with me in regards to different things and lifestyle choices and lifestyle activities that they're doing. So things like, constipation, type of exercise that you're doing, all those types of things can all lead to stress on your pelvic floor. So if we can sort of talk about those things and work out if there are any lifestyle factors that are affecting your pelvic floor health. If anyone has a more complex pelvic floor issue such as a prolapse or severe incontinence post-pregnancy or anything like that, then certainly specialised women's health physiotherapists are available, and we will definitely refer on to those if the issue seems to be too complex for us to help out with.
Yes, thank you so much.
And I'm sick of saying goodbye to the things I've been lucky enough to find, 'cause I was lucky enough to find.